With this technique, we are finally able to analyze the gait and posture of patients after spinal surgery in a more objective way compared with the typical widely used questionnaires. The technique is completely free of radiation and, once implemented, feasible with moderate effort. Furthermore, the good validity and high intra- and inter-rater reliability are great advantages of this method.
The functional aspect of the data that can be obtained with this technique is not only relevant for spine pathologies, but also interesting for general disabilities of the lower extremities.
We would advise a first-time user to focus on the relevant parameters needed for the main question, and to help keep the patient relaxed during the Rasterstereographic and treadmill measurements. The methodical setup of this technique is complex, with several potential pitfalls. Therefore, we believe that visual demonstration of this method is helpful for everyone who wants to implement it.
Before initiating the procedure, hang a 2.5 by 2 meter piece of plain black cloth or similar that entirely covers the background of the image to be taken to improve the contrast. Recruit a subject aged more than 18 years who suffers from lumbar back pain and degenerative disc disease. Gather all of the relevant data for the back pain-related patient history,
results from X-ray and magnetic resonance imaging, current pain medication, and history of physiotherapy.
Perform an orthopedic physical examination to identify the origin of the lumbar back pain, and to locate tender pressure points. Test the lateral flexion and trunk inclination.